Hello, I am Pharmacist. Today we talk about pharmacology, uses, side effects, contraindications, pregnancy warnings, drug interactions, and dose of ampicillin and amoxicillin. Pharmacology. Ampicillin and amoxicillin are a type of beta-lactam antibiotics known as aminopenicillins. They work by inhibiting bacterial cell wall synthesis. They bind to penicillin-binding proteins, which are enzymes involved in the formation of bacterial cell walls. This leads to the disruption of the bacterial cell wall, resulting in bacterial death. Ampicillin and amoxicillin have a broader spectrum of activity than penicillin G, with greater activity against some gram-negative bacteria. Uses. Ampicillin and amoxicillin are used to treat a variety of bacterial infections, including respiratory tract infections, urinary tract infections, skin and soft tissue infections, and gastrointestinal infections. They are also used to treat infections caused by susceptible strains of Escherichia coli, Haemophilus influenzae, and Proteus mirabilis. Side effects. The most common side effects of ampicillin and amoxicillin include diarrhea, nausea, vomiting, and allergic reactions. Other side effects may include liver toxicity, kidney damage, and anemia. Contraindications. Ampicillin and amoxicillin should not be used in patients with a known hypersensitivity to penicillin or any other beta-lactam antibiotics. Pregnancy warnings. Ampicillin and amoxicillin are generally considered safe to use during pregnancy. They are classified as pregnancy category B drugs, which means that animal reproduction studies have failed to demonstrate a risk to the fetus, but there are no adequate and well-controlled studies in pregnant women. Warnings. Ampicillin and amoxicillin should be used with caution in patients with a history of allergic reactions to penicillin or other beta-lactam antibiotics. They may also interact with other medications, so patients should inform their healthcare provider of any other medications they are taking. Drug interactions. Ampicillin and amoxicillin may interact with other medications, such as warfarin, which can increase the risk of bleeding, and oral contraceptives, which can decrease their effectiveness. Dose. The recommended dose of ampicillin and amoxicillin will depend on the type and severity of the infection being treated. They are usually administered orally. The dose may need to be adjusted in patients with renal impairment or hepatic dysfunction. The usual adult dose of ampicillin for respiratory and urinary tract infections is 250 to 500 mg administered every 6 hours. The usual adult dose of amoxicillin for respiratory and urinary tract infections is 250 to 500 mg administered every 8 hours.